Hello everyone, I am Julian Morris with the Channel 5 News. In the headlines, Dominica to benefit from CARICOM education drive on the importance of accepting the COVID-19 vaccine. IOM continues to boost capacity building with disaster preparedness training for first responders and a full Calypso season this year as Mass Camp announces plans to host a virtual tent. The details coming up.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid, but there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
With the rollout of COVID-19 vaccines, various publics around the world have been raising concern, saying they would not partake of these vaccines, citing possible negative health effects. The issue of vaccination receptivity formed part of a CARICOM-level discussion which the Prime Minister engaged in on Tuesday. The COVID-19 vaccines are expected to be available by the end of March, and one of the priorities will be the rollout of a public education campaign to ensure the public or the people of the region are receptive to the vaccines. Prime Minister Skerrit says taking the COVID-19 vaccines when it is available will be significant, as travel to certain countries may be restricted for individuals who have opted not to take the vaccines.
One of the main items we discussed is regards to the vaccines for the Caribbean region. As you know, we've been working with the Pan American Health Organization to source vaccines for us, because we recognize in CARICOM, obviously, the pecking order in the world, and countries where it's manufactured will always be the first to be served, and that is understandable. But we're confident that we will be able to get the vaccines based on the schedule that has been advised by PAO from the end of March 2021. And the other issue we discussed regards to access to vaccine is regards to educating our population about the need to be vaccinated, because we recognize that there's a lot of discourse on vaccines and not taking them, and who should take them, and why we should not take them, and why we should take them. And CARPA has agreed to develop some public education programs to educate the population in the Caribbean about the benefits of the vaccine, because that's important. And the reality is, every week that passes by, different countries are now requiring for our citizens to have a negative PCR to come to the country. So the United States, certain states in the United States, this week, and very soon, when these bigger countries would have recognized that their citizens would be largely vaccinated, then they're going to demand that you get vaccinated to come to the countries and to fly on a plane. And so that's the reality we're dealing with, and our hope is that our citizens in Dominica can recognize the importance of the vaccine. We just saw the Pope Francis indicating that he will take the vaccine because it is a moral obligation to do so. And so in regards to the vaccines, we're looking to end of March. This is a schedule that we ourselves have been looking at in our discussions with the Pan American Health Organization.
The Prime Minister says the economic situation confronting the Caribbean was also discussed during Tuesday's CARICOM meeting.
There is a huge financing gap of about $4 billion among CARICOM nations. This is a significant gap, and we've been talking about the mobilization of resources to help countries fill that gap. And one does not know how long the virus situation will continue with lockdowns and restrictions, and therefore curtailing people's travel. And so the mobilization of resources is going to continue to be a need. And there are also some structural adjustments and changes that we ourselves as governments will have to make as well. Because you're going to see an increase in debt. Even if you don't borrow, you will still see an increase in debt because there's a contraction in the economy. So your debt to GDP is going to increase, whether you borrow money or not. And so whether you borrow money or not, there are some structural adjustments, changes you must make within your economy to cushion the impact on the citizens. And we in Dominica, we've been doing so not only as a result of COVID, but consistently so, maintaining some very strong fiscal policies. And we have been able to control discretionary spending so that whatever funds we get, we can direct it to helping the citizens in job creation and ensuring that we can keep the health system fully financed to fight COVID, but also to deal with prevailing health issues. So it was a very timely meeting, very important matters discussed there.
It's a full Calypso season this year as Mass Camp has announced it will also be hosting a virtual tent. Andrea Louis has more.
The cancellation of Carnival 2021 saw the cancellation of pageants and other staples of the country's carnival culture, which would require large gatherings of people. Last week, the Dominica Calypso Association announced it will be hosting the semi-finals and finals rounds of a virtual Calypso competition. The Stardom Calypso tent had also informed the public that it will be hosting 5 tents for the Calypso season in order to bring the art form to the people. During an interview with Channel 5 News on Wednesday, Dr. Valda Henry, one of the directors on the Mass Camp Board of Directors, says that the Showdown Mass Camp will also be hosting a virtual Calypso camp in keeping with the spirit of the season.
Mass Camp 2021 will have a virtual presence. The details of that presence will be provided next week. Our Calypsonians all have their Calypsos. As I said earlier, the Calypsos are, those I've heard, I haven't heard all of them, but those I've heard are good Calypsos. So I expect to have a number of our Calypsonians at the semis and at the finals.
Though the camp will be having its own show, Dr. Henry is confident that one of the Mass Camp Calypsonians will be crowned the first ever virtual Calypso monarch in the competition, which is being organized by the Dominica Calypso Association.
Well, I'm hoping that we claim the virtual crown, the first virtual Calypso king. You know, we have some top Calypsonians who always deliver, who knows how to deliver. So I'm expecting that our Calypsonians will deliver virtually. So next week, Andrea, once I have more details of all our arrangements, I will give you those details. But the news is, and the story is, Mass Camp will have a virtual tent 2021.
A renewed call to Dominican women to take their health seriously. The reminder from President of the Dominica Cancer Society, Yvonne Alexander, as the country joins the world in observing International Cervical Cancer Awareness Month this month.
During that month, the Dominica Cancer Society is taking the opportunity to increase the awareness raising in relation to cervical cancer prevention. The fact is that although cervical cancer is the second most common cancer affecting women in Dominica, it can be screened for, detected early, and successfully treated so that nobody has to die as a result of cervical cancer. I know that people think of cancer as a death sentence, but in the case of cervical cancer, if it is detected early, it can be successfully treated and the person can survive.
Alexander urged women to take the necessary steps to check for cervical cancer.
During this month of January, we are calling on all women who have not had a pap smear recently to schedule your pap smear and have it done, because it is through the pap smear that the cervical cancer can be detected early and then treated, successfully treated. We have always been in collaboration with the various health districts. There are 7 health districts. We are working in collaboration with them, and in the case of the Roseau Health District, there will be a special cervical cancer screening on Saturday, 21st January 2021. This is in collaboration with some of the a few retired nurses and the Dominica Cancer Society.
The Cancer Society president is calling on doctors to get on board with raising awareness on the matter.
And we are encouraging all doctors who, to whom women will probably just come in for some unrelated matter, to find out from your patients when was the last time you had a pap smear, and encourage them to have a pap smear done. It is only through early detection that we can be treated successfully and survive some of these cancers that are affecting us here in Dominica.
This is Channel 5 News. Coming up, health officials continue to warn against illegal entry in light of the COVID-19 pandemic.
A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited Flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD, all for $160 a month with the new all-in bundle. With Flow, it only gets better.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid, but there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
First responders around the island have engaged in a disaster training workshop spearheaded by the IOM. Andrea Lui tells us more.
The initial damage assessment training is the capacity building initiative which supports the work of the National Emergency Planning Organization (NEPO) and the Office of Disaster Management (ODM). Communications Officer with the International Organization for Migration, Maxine Aline Esprit, says the IOM plays an integral part in disaster management as disasters can lead to the displacement of people.
Very often disasters force us to leave our homes. Disasters displace us, and therefore we become what we call in the IOM world internally displaced people if we remain within our country. But if we are forced to move outside of the country, which happens sometimes, and we have seen this happen, and we are right now in a situation where we're looking very closely, for instance, at the volcanic activity in St. Vincent and also in Martinique. And in our history here in Dominica, we have had to accommodate people who have been forced to move from their countries after natural disasters.
The first responders and community leaders were urged to be aware of their role in assisting and accommodating non-nationals who come to the country in time of disaster.
We have seen in the past in disaster response that sometimes people within the disaster response system feel that maybe, okay, you're not a Dominican and therefore you don't benefit. So people would go to shelters, for instance, emergency shelters, and they would be told, no, you don't belong here. And maybe not by the shelter managers, but maybe by community members. And these are things that we have to mitigate against. In the process of recovery and analyzing what the situation is after a disaster and providing support to people, we must ensure that we treat all human lives as being equally valuable.
Aline Esprit stressed the importance of the workshop in light of Dominica's topography and the ease with which communities are cut off during times of disaster.
It is important that at the community level, we have first responders who are able to provide the kind of information that is needed by the National Emergency Planning Organization through ODM, so that there is a sense of what is the status on a national level, in spite of whatever physical barriers might exist why you cannot move from your community in Grand Fort or in Cottage or in Siniku or wherever you might be. But at least you can help to gather first initial information at the community level that you can provide to the central system. So your role in the disaster response will be very important.
Parliamentary Secretary in the Ministry of Health, Kent Edwards, is warning against illegal entry into the country and its negative implications on mitigation efforts against COVID-19. As far as the travel protocols and guidelines introduced by the Ministry of Health, Edwards says they have proven to be effective in limiting the spread of the pandemic.
One travel practice that has weighed heavily on our system at this time is the illegal entry into Dominica via what we refer to as backdoor. Ladies and gentlemen, it is not only illegal, but it puts our country at significant risk. Those who enter the country illegally expose others to the virus, and we are asking everyone with any information regarding illegal entry to reach out to the authorities. You may do so anonymously if you choose, but this all forms part of the responsibility to keep our country safe. Also, part of our responsibility is to continue to follow the best practices as have been established by the ministry. Remember that it is mandatory to wear your mask whenever you are in public. This includes the traveling on the bus or in a business place. For those with business establishments, restaurants, bars, or even those who sell at the market, you are asked to wear your mask and to ensure that your patrons do the same. This is the law, and those who are caught not complying will be fined.
Edwards says while we await vaccination, the ongoing fight against COVID-19 remains that of every citizen.
For those of us keeping abreast with what is happening in other countries, we have to ensure that everyone traveling to our shores does not put the country at risk. We would hate to see a spike in the number of positive cases because we have become complacent or let our guards down. We are comforted by the fact that a COVID-19 vaccine has been developed. The Ministry of Health, and by extension, the government is working towards making this vaccine available to the general public as soon as that is possible. I wish to take the opportunity to commend the efforts of all those who have contributed to our success in this battle thus far. Every healthcare worker, frontline personnel, including fire and ambulance services, DASPA, and the stakeholders who have provided their support. But ladies and gentlemen, let me remind you that no matter what steps are put in place by the ministry or the government, no matter what protocols, policies are developed, beating this virus will take a conscious effort of each of us. You are the most important cog in the wheel. No matter who you are, you have an important role to play. Do not underestimate your value in this fight. Continue to work alongside us, everyone, and for every other well-being.
The Ministry of Health continues to incorporate Creole into its COVID-19 messaging to address the language barrier for non-English speakers.
E pa pazo we, i pa ni pes moun ki mo an peyi ya, i pa ni pes moun ki an l'hôpital an peyi ya pou nou dako tout bagay bon. Nou ni pou kontine ka fe sa nou ka fe, nou ni pou lave la men nou ni pou sanitize la men nou, nou ni pou gade karabete si pe hod yon e lot. Avec ces moun nan qui ka traverser l'autre pays qui venu ici backdoor en le tikanot, nous ka diso ça c'est quelque chose qui pas légal en pays. Ça c'est au compte loi. Avec si police chebezo yo qui fine zo. Avec nous ka di moun tout là où aller en place publique, si vous aller en bus, si vous aller en supermarket ou aller en la place là, on ne pour ni massou en la main. Avec nous ka di moun qui ka ni restaurant avec toute place publique, les moun rentre en place ou di yo mettez masque yo avec sanitize la main yo avec et pas because quand nous ka di pas pass nous ka croire tout bagay bon, nous ne pour assis dans le avec d'accord tout bagay aisé non, nous ne pour continuer qu'à faire ça nous ka faire pour changer vivre ça là COVID-19 rod nous.
Scientists from the UWI Seismic Research Center, SRC, are closely monitoring the impact that gases from the La Soufrière in St. Vincent are likely to have on people living near the volcano. The browning of the vegetation near the volcano indicates the presence of certain gases that could have a negative impact on people with certain health problems who live nearby. The UWI Seismic Research Center geologist Professor Richard Robertson has been addressing this and other concerns about the current effusive eruption at La Soufrière.
It essentially has to do with the gases are rich in sulfur and oxygen. When you mix that with a little bit of moisture and water, you have a dilute acid, and it's essentially burning vegetation. Now that effect is confined to where the gas plume is. The plume that is coming out as the magma cools, it lets off a lot of gases, and it's very weak, so it's slowly creeping down the mountainside. Currently, I'll say it's just about 1/3 of the top of the rim. It hasn't moved further down yet. In terms of concern to people, that's something that we have to watch, but most of the gases tend to become dilute. So yes, they have acidic properties, and yes, if you really go and stand in the crater and stick your nose in it, that's not a good thing. But by the time they get to occupied areas where people live, they should be dilute enough that they wouldn't be of any great harm. But increasingly, as the volcano populated dome gets to the top, as it pushes more gases down, as the gases get further down slope, the concentrations might get such that people who have asthma and people who have respiratory problems might find some discomfort. So what we have done is that we have recommended that the authorities start monitoring. We'd advise them on that, monitoring the environment, looking at what the concentrations of gases are in currently occupied areas, even though it's not anything above normal. But if they start now, if and when it increases, they'll detect that and then they could take action.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid, but there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited Flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD. All for $160 a month with the new all-in bundle. With Flow, it only gets better.
To end the news, the headlines again. Dominica to benefit from CARICOM education drive on the importance of accepting the COVID-19 vaccine. IOM continues to boost capacity building with disaster preparedness training for first responders and a full Calypso season this year as Masscamp announces plans to host a virtual tent. You may access the news on our YouTube channel. On behalf of the production team, I am Julian Morris. Thank you for watching. Join us tomorrow.